Michelle Rohr. I'm a student physical therapist from the University of St. Augustine. Can I please have your full name and your date of birth?
Cynthia Rohr, June 29, 1958.
All right, thank you, Cynthia. So we have you positioned here because you had let me check your wristband real quick. Okay, thank you. We have the right patient. So, Cynthia, the way that you are positioned here, it's because you have an acute left ankle sprain of the deltoid ligament. Is that correct?
Yes.
Okay.
And it's very painful.
Oh, no. So the treatment that we're going to do today is a low intensity ultrasound. And the reason why we're doing this today is because since you are in this acute stage of inflammation, meaning that you're pretty fired up, we want to help kind of decrease that inflammation by altering the cellular permeability, making sure not too many things are going to that area by using ultrasound. So by targeting that, that's going to help decrease your inflammation, which will also help decrease your pain. And those are your therapeutic benefits. How does that sound to you?
That sounds good, so I can go back to running.
Okay, so the parameters for today's treatment is that it's going to be a thermal superficial ultrasound, and it's going to be for about 5 to 10 minutes. The area that's going to be assessed will be about 2 to 3 times ERA, and we're going to use a large ultrasound head because this will help decrease the dose. We will also have a frequency of 3 megahertz and a intensity of 0.5 watts per centimeter squared. The duty cycle is going to be pulsed intermittent by 20%. Okay, and so those are our parameters for the treatment. Now I want to go over your precautions and contraindications with you. So one of the precautions would be that if you do have an infection, this can make your infection worse. Do you have an infection right now?
No.
All right, and I will just check too for any signs of redness, warmth, or swelling. She does have swelling, but there's no warmth, and she's not complaining of anything with that. All right, contraindication would be would be over any signs of malignancy. Do you have any history of cancer or current cancer at this time?
No.
Okay, great. So now we're also gonna do an inspection of her skin, first and foremost. So because we're looking at this area, we would want to look at all over, just looking for any signs of maybe acute redness or any burns or wounds or any infection. She seems to be okay. Now we want to also inspect her sensation. So just how we have done before, we're going to use this little egg. Cynthia, can you bring your right leg up for me? Okay, great. So what we're going to do is we're going to use this cotton ball, and I'm going to test it on your uninvolved side first, okay? You can keep your eyes open. I just want you to say yes when you feel it.
Yes. 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 Yes.
Okay, great. So now we're going to test your involved side. Can you go ahead and close your eyes for me, and please don't guess. Just say yes when you feel it.
Yes. 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 Yes.
Okay, great. Your sensation appears to be intact. Awesome. So you can go ahead and open your eyes. Now we're going to do a pre-assessment first to see, just to get a baseline of Cynthia's swelling in the area. So I would do a volumetric girth measurement using measuring tape, and I would measure the ankle, and I would get a baseline measurement. Okay, so I'm going to say I would have done that. All right, great. So now, do I have your consent to begin?
Sure.
Okay, so what we're going to do is that we're going to apply some ultrasound gel to our head here. Boing, boing, boing. Okay, and then I had already verbalized my parameters, so my parameters are going to be set here again. Okay, great. And so now I'm going to go ahead and apply the ultrasound head, and I'm going to go ahead and start treatment. And we're going to do this for 5 to 10 minutes. And just in case, the frequency is 3 megahertz, an intensity of 0.5 watts per centimeter squared at a duty cycle of a pulse intermittent 20%. All right, how does that feel for you, Cynthia?
Feels good.
Okay, if at any moment this feels uncomfortable, you just let me know and I'll be delivering this for you for 5 to 10 minutes. Alrighty, you're doing okay?
Yes.
Alright, it should be verbalized that the intensity will increase with skin contact. Also, the ultrasound head will remain in contact with the skin throughout the duration of treatment, as well as the speed will be maintained as well. Okay, alright, we're gonna say that the machine went off for 5 to 10 minutes. Alright, great, perfect. Let me remove the head and turn the machine off. Okay, now I'm gonna use a paper towel to go ahead and wipe the gel off my patient's foot. Okay, great. And then I'd also use a nice cleaning solution that's neutral to also clean that area of the foot so it's not all gunky and gooey afterwards. I'd use a different towel to clean the head as well. Let's say I changed it, as well as a cleaning solution. Okay, great. Now let's also check the patient's skin integrity following treatment for any adverse reactions, for any maybe signs of burning, or any inflammation or rashes. It appears to be okay. Now let's also do a follow-up assessment using the same volumetric girth measurements to see if there is any change in swelling. Okay, great. And now my intervention for today is that because my patient is in the acute stage, I am gonna go ahead and have her just do really low-level active ranges of motion, ankle dorsiflexion, nothing to the extreme, and no resistance for 31 repetitions to help increase vascularity and to promote tissue healing. All right, how are you doing, Cynthia?
Good.
Okay, great. All right, that concludes today's treatment. Thank you for joining us.